Good evening, everybody, and welcome to the PharmAssist virtual learning experience. I do apologize for the delay. As with anything that takes place on the internet these days, we just had some issues going live on Facebook. It seems like that is not going to work, so we will definitely post this up for everyone who was not able to listen to it on Facebook. And when you do eventually hear it, I apologize yet again. Blame the internet. It is not our fault. It's most likely all the kids and parents that are working from home, but we apologize for that. So for that all being said, let's get it started. Just like anything else, this is a Monday night at 7 p.m. And so we are here to talk about the PharmAssist virtual learning experience. And I do have, as you can see, a quick disclaimer that I'd like to read before we get started. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. So, now that we have the disclaimer out of the way, I want to once again thank you very much for taking your time out tonight to join us for the PharmAssist virtual learning experience. It's an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your very own home. The program will take place every Monday at 7 p.m. EST. Tonight, we will be having a live medication instruction program on 3 fertility products, including an interactive Q&A throughout the program. So when you have questions, be ready because this is live and you're able to ask them right here on Zoom. So the process of what we're trying to do with this is to have these amazing HCPs come in from all across the nation and provide you with a real world experience, just as if you were actually sitting across the table from them in the clinic and really being able to interact just like you were right there having a consult. And so today we are joined by Laurel Meier, and I am going to say in a minute, I'm going to turn it over to you, Laurel. I just want to say thank you again for your time and interest and for joining us tonight. Thank you for all your expertise. And now I want to turn it over to you, Laurel. Take it away.
All right. Hi, my name is Laurel Meier, and I'm an IVF case manager. We're going to be going over 3 medications tonight, Manicure, Progesterone Oil, and Ovidrel. There'll be a Q&A after every video, so please, I encourage you to write in your questions. Any questions you have, someone else is going to benefit from that question as well. This program, as well as all the programs in the past, are always available for you to watch at the PharmAssist program. It's at mymandelsPharmacy.com. These question and answer sessions should be focused, your questions should be focused on the medications and how to mix them and draw them up. If you'd like to ask questions about side effects or how the medication works in your body, that is also encouraged. Just if you have questions that relate to your specific protocol regarding how much you're supposed to take or timing, that obviously should go back to your clinic, that question. So what I'd like to do now is to share the story of how I became interested in becoming an IVF case manager. About 25 years ago, my husband and I started having trouble getting pregnant. We did several rounds of Clomid without success, and then we did 2 IVF cycles, and also without success. But while we were still reeling from the bad news of our last cycle not being successful, we got a phone call from a friend. A woman had delivered a baby, and she wanted to adopt out. And my friend told her about my husband and I, and she wanted to meet us. So we went down to the hospital and we met her, and she decided that she wanted us to become her baby's parents. So we took our daughter home on Valentine's Day, right from the hospital. And now that little baby's 20 years old. And then 4 years later, we were successful with a frozen embryo transfer cycle. It was a donated embryo, which was transferred to my uterus, and I was able to carry that little baby to a full-term delivery. And she is now 16 years old. So, and it just so happened she was born on 4th of July. So we got 2 holiday babies. So I wanted to show you my girls, all grown up now. That's Megan and Sydney. So it's been quite a journey. The reason I tell this story is because I know you're going through a difficult time. You wish you were pregnant yesterday. I know that. But I want you to keep the faith and take this one day at a time. The reason I became an IVF case manager is because I wanted to help people in your position. I feel grateful and blessed to be a part of your journey, and I want to make it as stress-free as possible. You will get through this, and you will be successful too. So tonight, my goal is to help you learn how to mix and give these medications successfully, give you the courage and strength to do these shots yourself, and I know you will feel like a pro very soon. So tonight we're going to start with the Menopure video, and then we'll have a question and answer session right after. Go ahead and start the first video, Craig. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopure. Menopure comes in little powders, and we're going to use our imagination, and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopure. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopure. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopure and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe, and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out and hold with the Kleenex. After about 10 seconds, check your skin site If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right. So I'm ready for any questions that have come in.
All right, thank you very much, everybody. And remember, if you do have any questions, you can just type them right either into the chat or directly into the Q&A box. We will definitely get to them. And unfortunately, one question I'll just throw out there. If anyone is listening to this after the fact on Facebook, please feel free to message us if you do have questions based on the video. We will pass any of those questions on to Laurel, and we will get an answer and get back to you. So I do apologize for the issue there. But the first question that's coming in, Laurel, I just want to see. You were talking a little bit about how to mix it, and it seems like there were some questions just around like how it looks beforehand. And it says here, how important is the way the Menopure looks prior to mixing? Does it take long to mix once I inject the liquid? So kind of it looks like a dual question there.
Okay. The medication is going to look like a disc of powder. In fact, I have a sample here to show you. It looks like this. It's this little disc of powder, and it will dissolve instantly once the liquid touches it. So no problems with it mixing. It should just dissolve really, really fast.
Perfect. Thank you very much. And we've obviously heard the question about the way Menopure looks, so it's good to hopefully put that to rest for a lot of people so they don't feel like there might be something wrong with it. Okay, so another one came in that says, I read that using more liquid can make the injection less painful. Is this true, or does the liquid amount not actually matter?
So that's a good question. When you give a subcutaneous shot, you don't want to give more than 2 milliliters of liquid. But if you use more liquid, it's going to end up hurting more. So what we recommend is to use 1 milliliter of the liquid to mix up to 4 vials of Menopure. And that's perfectly fine. If you are using only one vial of Menopure, feel free to use 1/2 of a milliliter of liquid or up to 1 milliliter of liquid, and that is perfectly fine. When you get up more than 1 milliliter, you're going to see that it's going to hurt a little bit more. And the goal is to make this hurt as little as possible. And the trick to that is to give this shot as slowly as possible.
Perfect. Thank you for clearing that up. And just to reiterate that it is more liquid can make it actually potentially more painful, not less, which this question I was asked, the person asked, so we just want to make sure that they pick up on that. So a question about the Q-cap that you walked through the process on how to use that. And it says, is the Q-cap necessary? Can the mixing just be done with one of the needles that I already have?
Good question. So the Q-cap is a really nifty needleless mixing device, and I highly recommend using it. However, if you didn't get it, or if you would prefer to mix with a needle, you can do that. What you would do is you would add the long needle onto the syringe, and you would put the 1 milliliter of air into the syringe, push that into the liquid, draw back 1 milliliter of liquid, mix your powders just like you would if it was a Q-cap. And when you're all done, you're going to want to take that long needle off and put a short little 1/2-inch needle, the giving needle, on, get rid of the air, and give the shot. So that is perfectly fine to use a needle if you prefer.
Perfect. Thank you so much. Great answer. And one other question comes in here that talks about, so we got this one actually pretty often. This comes through quite a bit, and I think this is a perfect time for it. So I'm taking a number of different shots, and I was wondering, what exactly is Menopure? What impact does it have on my cycle?
Good question. So Menopure is a purified FSH, and it has luteinizing hormone, or LH, added to it, which is also an important hormone in stimulating the ovaries in an IVF cycle. So what FSH does is it stimulates the ovaries to mature the eggs. The follicles are called the antral follicles. Those are the ones that are going to potentially mature, and it will stimulate all of those antral follicles to get to the mature state so you can have a successful egg retrieval. It does, however, have the side effect of making your ovaries larger, so you can get some bloating because of it.
Thank you very much, Laurel. That's great. Hopefully that helps everybody just kind of get an understanding. Not all the questions have to be about, am I doing this correctly, or how does this, how do I give this shot? But it can just be more like, I'm not even sure what I'm taking. So thank you for clearing that up, and thanks for asking that great question. So as of right now, Laurel, we've gotten through the questions that have come through. I'll kick it back over to you. So if you're trying to get in that last question, you're trying to type something out, we'll give you another 30 seconds or a minute to get it out there. But Laurel, in the meantime, I'll throw it back over to you.
Okay. So Menopur does have potential side effects. As I said, it causes the ovaries to get bigger, and that's because every follicle is getting bigger. It starts out very, very small, and it gets to be the size of about a grape. So not 10 grapes developing, 10 eggs developing on each ovary, which is a fairly common number for women going through an IVF cycle. You're going to get pretty big ovaries. The ovaries start out about the size of a walnut, and then they grow. They can get as big as an orange. Hopefully not that big, because that is painful. But what you're going to experience and expect to experience is some bloating and some heaviness. You're going to feel like you're carrying a couple rocks around in your pelvic region, one on each side. So it's sort of that heaviness. You also may experience some bruising at the site. And you just want to make sure that with any next consecutive shots, you don't give them into a previous bruise, and that bruise should heal over about a week's time. It's not a problem. It doesn't mean the medication didn't absorb. It's just one of those potential side effects. And I think that's about it for Menopur. We can move on to the next video, which is the progesterone in oil. Hi, my name is Laurel, and I'm here to show you how to draw up and give the progesterone in oil. Progesterone in oil is used to maintain the uterine lining during usually a frozen embryo transfer cycle. Also, if you're going to have a fresh transfer, it's typically started on the day of egg retrieval or possibly the day before. Just follow your instructions from your clinic on when to start this. So progesterone in oil is a fairly thick medication. You want to pop off the top and use an alcohol wipe to clean the surface. And then you're going to take your needle and syringe out of the packaging. The typical dose is 1 ml. So I would draw up 1 ml of air first, and you take off the top. Inject this into the center circle. Inject the air in, and then invert. You want to pull back so that the tip of the needle is in the oil, and then pull on the plunger. As you draw back, the oil will leak down the side. Now, what we do is we have you draw up and give with the same needle. It takes away a step of having to use a draw up needle and then an injection needle, but it does take a little longer to draw it up, so you just have to be really patient as it drips down the side very slowly. Feel free to pull really hard on the end of the syringe there, because that's going to create that vacuum and pull that medication out. So if you get a little bit more than one, that's okay. You're going to push the air in and go to the one line. If you don't quite have one, you can pull more and then push back to the one line. So there's one. Little teeny bubbles you can ignore. And now you're ready to give the shot. Now I'm going to recap this because we're going to go over a few things about giving intramuscular shots. This is not a belly shot. This is the one that's given in the upper outer quadrant of the hip. And it's given for many days, even many weeks at a time, because it's important in maintaining the uterine lining. So your hips are going to get sore. Now, the actual shot doesn't really hurt any more than the shots in the belly, but it does make your hips sore. So you're going to give a shot on one hip one day. The next day, you're going to switch to the other side, and you're going to go back and forth each day. Prior to giving the shot, if you'd like to ice the hip a little bit, that works. You can use some lidocaine cream or a Synergia patch to decrease the pain. But one really good way of just tricking the skin into not feeling the poke is pinching the skin really hard. And if you pinch it several times, it's going to trick the skin into not feeling that poke. Now, as the person that is receiving the shot, you want to make sure your hip muscle is completely relaxed. And the best way to do that is to lay on a bed, flat on your stomach, and just relax. If you point your toes inward, it's going to keep you from being able to tense your hip muscle while you're receiving the shot from your partner. Another way you can receive the shot is by standing and putting all of your weight on the opposite leg from the side you're receiving the shot. And that works fine too. Your partner can sit in a chair next to you while you're standing. So to give the shot, you want to get in the correct position, and your partner is going to pinch your hip many times and nice and hard. And with a good hard pinch, it's going to go, he or she will go straight in like a dart. All the way to the hub, let go of the pinch, and then you're going to inject this medication all the way. And it does take a little bit of time because it is a thick oil going through a skinny needle. Once all the medication is instilled, you're going to take a Kleenex, you're going to pull out and hold very firmly against the skin. After about 30 seconds, you'll check, is there any medicine leaking out? Is it bleeding? If not, you're done. If there is, just keep holding it until it's dry. Now, your clinic may have you draw up this medication with a larger bore needle. It's called an 18 gauge. If they do, I want to make sure that you know that you don't give the medication with this because this is very thick, as you can see. So you would draw up with this, and then you'd switch over to the skinnier one to give. Now, in our clinic, we just have you draw up and give with the same needle. As I said before, it takes a little longer to draw it up, but it does remove a step. So just follow the instructions of your clinic. This will go in your sharps container. Your progesterone will be good for usually for 10 days. It's a multi-dose vial, so you're going to put this away. It does not get refrigerated, so just keep it in a safe place for next time. That's all there is to it. All right. Any questions, Craig?
Yes, there are. So just, again, throw it out there for anyone. If you have any questions whatsoever, just type it right into the Q&A or into the chat, and we appreciate it. And we'll give you some time to think about some things. But this one came in early. So Rebecca has this question. She actually had one of this even before you started the progesterone discussions. So she's been anxiously waiting this answer. And can you share any tips for reducing knots with progesterone and oil shots? I'm warming the vial before, using a heating pad before and after, walking 10 minutes after, massaging after, etc.
You're doing you're doing all the right things, Rebecca. Let's see. So we encourage patients to give the shot in the morning. If you do it in the morning, then you are using your muscle all day, and that's going to really help it absorb. Giving it right before bed is not really a good idea because then you're not using that muscle and it's not absorbing. I think you're doing all the right things. I think massaging it for about 10 minutes afterwards really does help break down and help absorb the progesterone and oil into the muscle. You want to make sure that warming it is great. And I think if you ice the site prior, just make sure that you're not icing it for very long. Only about 60 seconds to ice the skin and numb it a little bit so that you're not actually cooling the muscle at all.
Thank you, Laurel, very much. We appreciate that. I'm sure Rebecca definitely appreciates that. And these are, again, plenty of these questions are things that come up on other shows that we've done before. So even if it's, you feel like the question's already been asked, you feel free to ask it because this is new to somebody always for the first time. So we appreciate all your questions, just like this one right here. So you discussed about the intramuscular shot, the differences in how somebody does that. But we have this question that says, I've never given myself an intramuscular shot before. How do I know if I'm actually inside the muscle? Is it dangerous if I don't go get it exactly into the muscle? Should I take it out and try again? It seems like they want to make sure they're doing this correctly.
Right. Okay. So that leads me to talking about different sites, and I think this will actually help Rebecca as well. I showed a map that looked something like this, where you have your two upper outer quadrant sites, and that's a great site to give an intramuscular shot. This site is also really, really good, and this is right on the side of your hip. If you were to reach down right now and find your hip bone and go right below your hip bone, and you can try that now if you're watching this video, just find your hip bone, slide your fingers down, and this site right here called the ventrogluteal muscle is a wonderful place to give the shot. There's less fatty tissue there. You know you're going to get it into the muscle. And you don't have to aspirate when you use this site. So knowing that it's in the muscle, you want to make sure that the needle is inserted all the way into the skin, so the hub is against the skin firmly. And you want to have the right length needle. Most of us are going to have the 1.5-inch needle to give the shot, and that's going to adequately get this into the muscle. Some people, if their BMI is less than about 20, so they're real thin, they can use a 1-inch needle, and that will get into the muscle. And I just wanted to mention about the aspiration. They have shown that if you do use this site, it's a good idea to aspirate, and I didn't bring that up. So I wanted to show what aspiration technique is, so everybody knows that they should do that if they use that dorsogluteal muscle. So what you're going to do is once it's in, you're going to pull back just a little bit on the end of the syringe and look for blood return. If you see a little blood come in here, then you know that the tip of that needle is right in a vessel, and you don't want to give a medication directly into a vessel. So what you would do is pull out, hold it with a Kleenex, switch to a new needle, and go to another site. And you can give this medication, even if there's a little blood mixed in, you can give that to yourself. It's perfectly safe. So just as a review, if you use this site, upper outer quadrant, you do need to aspirate. If you use the ventrogluteal muscle, you do not need to aspirate.
Perfect. Thank you so much, Laurel, for explaining that and for getting a chance to bring that up, because I know that we don't always get to cover everything in those little videos, so that's the perfect time for Q&A, is to really get a chance to answer any of those questions, some of the more details that you might be wondering about. So I have a question here, similar to actually we had from Menopur, so this is a great time. We might as well jump right into it. Is just very simply, how does progesterone help my cycle? What is it doing?
Good question. Okay, so progesterone is given when you're going through what's called a frozen embryo transfer cycle. And it maintains the uterine lining. So it first will change the uterine lining so it's receptive to the embryo, and it creates a good home for that embryo to grow. And then it maintains that lining so the embryo can grow and develop adequately and healthfully. The placenta will take over in progesterone manufacture at about 10 to 12 weeks of pregnancy, and that's why you can stop taking this medication safely at that point.
Thank you, Laurel, very much for explaining that. It is always great to know what all these different medications are doing, and you have a better understanding of why your doctors and your nurses are talking to you about different medications and the importance of them. So always please keeping those questions coming, because we love to make sure we're not just educating on the technical side, but also on the educational side as a whole. This question actually just came in, and I feel like a perfect time to bring it up because Rebecca had a follow-up question based on her earlier question. And always, if you think of a question that comes out of somebody else's, let us know at the end. We'll have time. Everyone can bring up questions that come maybe after the discussion has passed. But one quick thing from Rebecca is, how much of a range is there in the location of the progesterone shots? Should you stay away from any knots from previous shots? Is it okay to go down a little lower as long as it's still in that upper outer quadrant?
Good question. Yeah, you want to stay away from the knots. And you also have the lateral part. So you really have quite a bit of range here. You can give it anywhere here on both sides, left and right. You can give it anywhere here, both sides, left and right. So as long as you stay away from those knots, you're good to go.
Great. Thank you very much. And Rebecca, if you think of anything else, we are here for you. That's what this is all about. One last question here about a little bit more about the specifics of the medication. It says, is there a difference between using the progesterone in ethylolyate versus sesame oil?
Oh, ethylolyate. Okay. Progesterone in sesame oil is manufactured by the company. The sesame oil tends to cause an allergic reaction with some percent of people. We're going to have some itching, some redness, and maybe a rash at the injection site because of the sesame oil. So if that happens, you can just talk to your clinic and they will order you progesterone in this other base called ethylolyate. And what Mandel's does is they will compound this medication for you. And it's a little bit more expensive, not much more, but a little bit more, but fully worth it. It's a thinner medication. It doesn't cause the allergic reaction that the sesame oil can. And it also absorbs into the bloodstream a little bit more readily because it is thinner. So that's the difference. They both do the same thing, just one is in a different base than the other.
Excellent. Thank you so much, Laurel, for clearing that up. And at this time, we have gone through all the questions. So I will throw it back to you just to give I'll give you another 30 seconds. If you have any more questions, get them in now. Again, don't worry. We will get time at the end to any questions that you didn't get a chance to ask, but I'll throw it back to you, Laurel, while people get a chance to type.
Okay. I'm just talking about the side effects a little bit of the progesterone and oil. You can get that rash at the site or itching, discomfort, and the knots that Rebecca was mentioning. Those are all things that can happen. If they do, please tell your clinic because there are options in changing to the different base, and they want to hear from you because they want this experience to be as stress-free as possible. So back to you, Craig, for the next video. Hi, my name is Laurel, and today I'm going to show you how to inject the Ovidrel sugar shot. The Ovidrel sugar shot is used to stimulate the final maturation of the eggs in preparation for the egg retrieval. What happens is you give this shot approximately 36 hours prior to the egg retrieval, and it will stimulate the eggs to loosen from the inner follicle wall so your egg retrieval can be successful. Please make sure that you take this shot at the exact time that your clinic tells you to. So to give this shot, you're going to take it out of the box. It comes in a pre-filled syringe, so it's super simple. You just point it toward the ceiling, give it a few flicks, take off the top, and then you want to get rid of that air that's at the top. So you're going to push on the plunger, and you're going to get rid of the air until you see a little drip of liquid at the tip, like that. Now to give the shot, you want to pick a spot in your abdomen. And you can pick any spot you'd like, as long as it's at least an inch away from the belly button. And there's some fatty tissue to squeeze. So this is going to be my abdomen for the demonstration. And what I'm going to do is just give it a good pinch and hold it at a 90-degree angle. I'm going to go in quickly like a dart, let go of the pinch, and then I'm going to inject the medication. Once the medication is completely given, you want to wait about 3 seconds. Take a Kleenex, pull out quickly, and hold your skin with the Kleenex. After about 10 or 15 seconds, you'll check your skin. If it's dry and not bleeding, you're done. If you do see some liquid, or if it's bleeding, you're going to hold it a little bit longer. Recheck it. If it's dry, then you're all done. Now to get rid of this, you're just going to drop it straight into your sharps container without recapping. And that's all there is to it. All right. Any questions, Craig?
Yes, absolutely. There is this first one just came through. It says, I always hear it referred to as the trigger shot. Can you just explain a little bit more of what that actually means?
Absolutely. So Avidril is used to trigger the final maturation of the eggs. For an egg retrieval, it's typically given about 36 hours prior to the egg retrieval. And what it does is it completes the process of maturation. The eggs are stuck on the inner follicle wall. Their follicles are fluid-filled sacs. They're about the size of a grape. So if you can imagine a cluster of grapes, that's about what your ovary looks like. And the egg is stuck on the inner wall. So the Avidril will loosen that egg from the inner wall so that the eggs are free-floating in the fluid. And then when the doctor inserts the needle into each follicle and drains the liquid out, the egg will come with it. The egg goes with the fluid down the tubing into the test tube. The test tubes are handed over to the embryology staff, and then the eggs are isolated. So that Avidril is a super important medication for the success of your IVF. Also, if you're taking Avidril prior to an intrauterine insemination, it will be given a little bit more than 36 hours prior to that insemination, because what we want it to do is to for the eggs to release from the follicle and start to travel down the fallopian tube. So that's why Avidril is given. So please make sure that you follow the instructions of your clinic and that you give it at the exact time that they tell you to.
Perfect. That was actually a perfect answer, because it gives a perfect transition to this other question that came in, which we have also gotten a couple of times, but just specifically says, my nurse gave me an exact time to take the shot. Is this more of a general recommendation, or does it need to be spot on?
Okay, yeah. I would say spot on within 5 minutes, one side or the other of that time. It's important. And if for some reason, accidents happen, if you forget to give it, if you give it an hour late, something happens, you get stuck in traffic, whatever, just tell your clinic that you gave it late and tell them the time you gave it, and they may need to adjust, things in the future. They may need to adjust your egg retrieval time or your insemination time. But as long as you keep that communication open with your clinic, everything should be fine.
Perfect. And I know obviously the key takeaway there is if you hear an exact time, probably try to stick to it at all possible. It will always make life easier. So thank you, Laurel, for that. So the next question that comes in here is, my friend had a bubble in her Avidril, but she said that her doctor told her that it's not a problem. Is this true, or should I be worried? I've seen enough movies to at least ask.
Yeah. So bubbles can be scary. Little bubbles are absolutely not a problem at all. You can ignore those teeny little bubbles that get stuck on the sidewall of the syringe. What you don't want to do is have a big section of air and inject it into your subcutaneous fat. It's going to sting. It's actually not going to harm you. So don't worry about air. I would say just get rid of the majority of it. And if you see any little bubbles, you can ignore them safely.
Great. That's good to know. So don't get your medical advice from TV shows and soap operas, and come to PharmAssist where you can get actual real advice. Perfect. So it seems like we have gotten through most of the questions right now. I am going to just toss it over to you. I'll give everyone a second here, we just got a follow-up. So before we even take that break, a follow-up question. I was going to say anyway that we're opening it up to any of the 3 products now. If you have questions about either Menopur or Progesterone in oil as well as the Avidril, now's the time. And we do have a follow-up question here, and this one is from Rebecca's husband this time. And she specifically put in the question, there's a question from my husband, smiley face emoji, and I like that. Perfect, well done. Can you talk about the angle of entry for the progesterone shot?
Absolutely, yeah. So you want to go at a 90-degree angle to the skin surface. So just make sure that, let's say Rebecca is lying flat on her stomach on the bed, and you're sitting next to her. It's going to be like this because she's not straight up and down. So it's 90-degree angles to the skin surface. Wherever that skin surface is, it's 90 degrees.
Perfect. Thank you so much, Laurel. That was great. And we appreciate all these questions. Sometimes we think of questions based on Laurel's answer, and that's a perfect time to follow up because you're not always going to be able to get that opportunity. With all that being said right now, it seems as though we've gotten through just about all of our questions. As I said, if you have any questions about any of the three products, now's the time to ask. I will, in the meantime, throw it over to you, Laurel, as you just kind of start getting ready to wrap up this great program tonight.
Yeah, well, thank you, Craig. It's been a pleasure. The reason I got into this as an IVF case manager is because of my experience in going through this myself. And I just want you to know that you're in good hands with Mandel's. I know that several of the people that work at Mandel's have personally gone through infertility as well, so they understand what you're going through. And they want to make this process as stress-free as possible. So you're in good hands there. And I just wanted to thank everybody for being here and your time and your energy, and just know that you're going to get through this. So keep the faith, take every step one day at a time, and you will get through this. I know you will.
You absolutely will. And I know one person who is definitely going to go get through this with no problem at all is Rebecca, because she is basically PharmAssist with Rebecca today, because she has another question for you. And I wanted to get to that real quick so she didn't think that we didn't see it. She said, can you talk about timing for the progesterone shots? Is it okay to shift them slightly over time? Obviously in comparison to what we were talking about before.
Yeah, that's a good question. I would say mornings are best, and to try to stick with the same time every morning. If you need to shift it by an hour or two because of your work schedule or your husband's work schedule or whatever, that is totally fine. Just try to be as consistent as you can. And if you need to completely switch, like from AMs to PMs, I would talk to your clinic first about that.
Great. Thank you so much. I really want to thank you how much we appreciate all of the information that you have shared today, Laurel, all the great questions that you guys asked. Rebecca even followed up to say, this is such a wonderful program. Thank you so much for the wonderful information. And thank you, Rebecca, and all of you who have joined in tonight and been able to share your questions, learn from this program. That really is what it's all about. So as we get ready to wrap it up, I want to thank you, Laurel, for your time and your expertise. You brought a ton of knowledge today, and we honestly, couldn't do any of this without your availability to share your knowledge. So thank you for that. Thank you for all of you who joined via the Zoom program tonight, and anyone who gets a chance. Just to reiterate, if you see this afterwards on Facebook Live, you can always message us at Mandel's Clinical Pharmacy with any of your questions. We will certainly pass those on to Laurel and get you back any answers that you have. Do not forget all these full virtual learning experience videos, or VLEs as we call them, as well as all the individual product demonstration videos that you saw tonight, are available on demand at our YouTube page, our Facebook page, and at our core site where you can come to our website. It's our mymandelsPharmacy.com/PharmAssist. We look forward to seeing you all here again next Monday night at 7 p.m. EST for another excellent program. We would love it if you would share this program with anyone that you feel can benefit from it, family members, friends, people in the clinic that you might be going to. Let them know, so that the more opportunities that we can to share great information with people and also get great questions, the more it is. Thank you again so much for your time. Thank you, Laurel. Thank you, everyone, for being here.
Good luck, everyone.
Absolutely. Good luck, and have a great night. Thanks again.